Hello, my name is Letizia and I'll be talking about stigma concerning mental health and males. In 1998, the Australian government added mental health to their list of national health priority areas. Following this, a national survey of mental health and well-being was conducted, finding that 17.7% of Australians had experienced symptoms of a mental illness within the past 12 months before the survey was conducted, with women experiencing a higher rate of symptoms of anxiety and depressive disorders compared to men, who are twice as likely to experience symptoms of substance abuse and commit suicide. Since then, there has been an increase in the rate of mental health disorders throughout Australia, which affects 1 in 5 Australians. In 2007, it was reported that around 45% of the population, or 7.3 million people, had suffered or were suffering from mental illness. Thus, it can be conjectured that mental illness does not discriminate, affecting people of both genders. However, statistics show there is a vast contrast between the two genders. It has been reported that women are more likely to experience a mental disorder compared to their gender counterparts. Yet, it has been shown that men are 3 times more likely to commit suicide compared to women, which is the leading cause of death amongst males aged 15 to 44. In 2015 alone, there were 312 male deaths for every 100 female deaths caused by self-harm. Therefore, men account for 75% of all deaths by suicide in Australia. These statistics are harrowing, with many researchers reporting the reason for these differences in genders is the stigma around seeking mental health services. The Australian Bureau of Statistics noted that only 27% of men seek professional help for a mental illness compared to 40% of women. Beyond Blue stated that this could be due to the fact that men are less likely to talk about their feelings because they hold particular beliefs around their gender. Such beliefs are that men are supposed to be tough, self-reliant, able to take charge and manage their pain. It was further reported that men have lower rates of mental health education and help-seeking behaviours. Thus, the expectation held by many men about needing to be resilient make it difficult for them to seek help when they are in need, therefore making men more likely to commit suicide. Furthermore, Wang and Al discovered that men often have more negative attitudes towards depression than females and attribute depression to a weakness of character. Nevertheless, it can be theorized that a lot of these issues are brought about by the stigma surrounding mental health. Beyond Blue defines stigma using 3 components: problems of knowledge, which incorporates ignorance or misinformation, problems of attitude, which is prejudice, and problems of behaviour, which is discrimination. Stigma can be identified in 2 ways: personal and internal, or public and external. Olive and L describes internal stigma as feelings of inadequacy resulting in individuals losing self-esteem. The researchers also describe external stigma as negative stereotypes about individuals and communities in a population group where mental health is being reported. Beyond Blue further reports that males are more likely to experience discrimination in social settings compared to females. Considering these findings, we are able to recognise why men have higher suicide rates, as they don't seek help as readily as females. Still, there are many ways in which stigma around mental health can be diminished. To combat stigma, we first need to understand it. This is central to reducing the negative associations individuals hold around the subject of mental health. We need to create interventions and programs that encourage those experiencing mental health symptoms to come forward and seek help. This needs to be done by counteracting the effect that public and self-stigma have on an individual. Beyond Blue say that to decrease stigma around mental health, we need to take educational and contact approaches. Educational approaches include informational resources which aim to change attitudes towards mental health, and thus encourage individuals that are suffering to recognise their condition and to seek help. This also helps contest any stereotypes they may have and provide them with evidence-based information. Contact approaches include forming relationships with individuals who are suffering from depression and anxiety. Corrigan and Watson stated that stigma decreases in a population when individuals meet with people who suffer from a mental illness and realise that these people are able to work and live fruitfully in their communities. By implementing these approaches, it will help to alleviate stigma's adverse impact on seeking help. Thus, from this information, it can be perceived that stigma affects some males from seeking help for mental health issues. To change attitudes toward mental health, men must be willing to put aside gender roles that men hold within themselves, as well as empowering males with education on the issue. The wider community also needs to amend its negative associations of mental health and thoughts that the mentally ill must be unstable, and thus allow all individuals, regardless of any disorders, the right to obtain jobs and housing. Further funding and government policy is needed to fully alter the population's perception of mental health through education and contact approaches. Thank you for listening.